Hi guys, this is Dr. Armelino with Nova Spine and Rehab Center at 803 West Broad Street, Falls Church, Virginia. I'm here with my patient Michael today. I've been taking care of Michael for years. Michael unfortunately has had some chronic shoulder issues going on in his left shoulder. Do you want to tell the folks at home what's going on with the shoulder and how it's impacting the quality of your life and work, just so they have an idea?
Well, this has been going on since I was 16 years old when I had some major surgery for a dislocated shoulder. They've done some botchy surgery in the early 60s, and it's taken its toll right now where I am almost 70 years old and I do not want to have shoulder replacement. So ART is something that allows me months of pain-free shoulder and motion to happen.
So for those of you at home who don't know, ART is known as active release technique. It is a specific protocol developed for specific muscles, tendons, ligaments, so we could be a little bit more specific to release them, to get some longer lasting relief for the patients. Today, because I've been working with Michael for years, we do a combination of ART and some other basic stretches in there. I will let you know which moves I am doing are ART based, just to help clarify in there. So, just so the folks at home can see how much this is impacting you, Michael owns a restaurant, by the way, in Old Town Alexandria. Try to raise your arm up as high as you can, just so people can get an idea to see how high you can go right now.
That's it.
That's about it.
That's it.
Okay. So, let's get in and get to work. So, I'm going to have you go ahead and raise your arm up as high as you can.
Okay.
You're going to take a look at your left hand. You're going to keep your eyes on your left hand as you bring your hand down and across towards your right knee. We've got to be very careful. His shoulder dislocates just like that, which is why you saw him wince a little bit in there. So very, very slowly, go ahead and, this is not ART, but go ahead and bring that arm down towards the shoulder. You doing okay with that pressure?
Yeah,
good. Come on back up.
It feels good.
Go ahead and bring it on down. Good. Come on back up. Go ahead and bring it on down.
Much easier now.
Good. Back up. Next move we are going to do, let's have you go from right here and go ahead and just relax. I'm going to take your arm through the motion. You want to reach back like you're trying to put something in your back right pocket.
Okay.
This is an ART move that I am doing right now to get on the insertion point of his supraspinatus muscle, one of the rotator cuff muscles. And we're going to then work on the muscle belly here in a little bit. So go ahead and just relax. Perfect. Go ahead and reach down and back and take your time. You doing okay with that pressure? That's good. Good. Come on back. Go ahead and reach down and back. Excellent. Okay. One more time. Go ahead and reach all the way down and back. Excellent. We're going to do the same motion, but I'm going to get on the muscle of a different portion. So go ahead and reach all the way down and back one more time for me.
All right.
Good. Come on back up. Go ahead and reach all the way down and back. Good. Come on back up. One more time. Go ahead and reach all the way down and back. Excellent. Perfect. You can go ahead and just relax your arm. I'm going to get on right now. So you go ahead and just relax. I'm going to do all the work for you. Right now I'm doing an ART move to help release his upper trap. You doing okay with that pressure?
Mm-hmm.
Okay, good.
That feels good.
Perfect. Now, let me have you just slide over about a foot over. Next, we're going to do an ART move to help loosen some of the ligaments up in his shoulder joint, okay? As a result of some of these botched surgeries, he's got severe degenerative arthritic changes going on in the shoulder joint here. As a result, all of the muscles have gone into spasm, have locked up and guarded, and prevent him from getting that normal range of motion. So go ahead and just lift your arm up for me. Your first motion that we're going to do, you're going to go from right here and you're going to rotate down as far as you can in there. but I'm gonna have you just lean over just a tiny bit. Sit right there, so it's kind of like you just lean into it just a little bit. Perfect, there we go. Go ahead and rotate that arm down for me, please. Good, come on back up. Go ahead and rotate it on down. Come on back up. Go ahead and rotate it on down. Excellent. Now we're going to do the opposite motion. I'm going to have you just relax, and you're going to go from right here to bringing this arm up just as high as you can to where you can tolerate. Go ahead and bring that arm up. Good. Go ahead and bring the arm up. Good. You folks can't hear at home. There's a lot of popping, clicking, crack, snap, crackle pops going on in his shoulder. We are ripping up scar tissue and adhesions right now deep in his shoulder joint. So come on up one more time for me. Boom. Ow. Boom. There we go. Perfect. Let me have you go ahead and lie face up for me, please. And I'm going to have you slide on over this way just a little bit, just so that arm can hang off. What I'm doing right now is I'm doing a stretch for his pec minor muscle. This is not an ART move, just a basic little stretch that we are doing. So I want you to go ahead and punch on up towards the ceiling for me as high as you can. Good. Go ahead and just relax. Go ahead and punch on up as high as you can. Good. Just relax. Punch on up one more time. Good. And just relax. Let me know when it is a good enough stretch and you want me to stop. You have to go very, very slow. His shoulder will dislocate easily. You doing okay with that stretch? That's about it.
That's good, yeah.
Same thing. Let me know when it's a good enough stretch and you want me to stop.
That's good.
One last time. Let me know when it's a good enough stretch and you want me to stop.
That's good.
Good. All right. Just have you slide back over to the middle of the table there. Perfect. I'm going to do one last move with him before we test his shoulder range of motion. Go ahead and just relax. I'm going to do all the work for you. Right now I'm going to do an ART move to get in on his subscapularis. It's a muscle that's often underlooked in most doctors' offices. It's on the front side of the scapula, so it attaches between the shoulder blade, the scapula, and the rib cage, and the muscle's right on the front in there. Unfortunately, the only way I can get into it is I have to get in through the armpit. You doing okay? Perfect. Let me help give you a hand up. Can you tell the folks at home, how's it feel while you're getting this soft tissue work done?
Well, it's definitely a lot of cracking, popping, movement that I cannot really do on my own without Dr. A's help. I know that I can try and put my arm up now, and here we
Much
go.
better. Much
The
better.
range of motion is unbelievable. As where before I could not reach.
Big difference in your range of
Yeah.
motion. Anybody at home is having any shoulder issues, you have any hip issues, come on in. We would just love to help you out at the end of the day. This is Dr. A with Nova Spine Rehab Center in Falls Church, Virginia.